Hello, I'm Dr. Tracey Skale with another mindful moment on behalf of Encompass Training and Consulting. Today we'll be talking about bipolar depression. Bipolar depression is one phase of a complicated illness known as bipolar disorder. People with this illness can present in multiple different ways. Sometimes they're depressed, sometimes they have mania, sometimes they're in a mixed state, which is a combination of those two, and sometimes they present with euthymia, meaning they're neither depressed nor manic. Today we'll focus on the bipolar depressed piece. Although major depression is the leading cause of disability in the U.S. among ages 15 to 44, with about 6.7% of the U.S. population over 18 presenting with major depression in a given year, and bipolar disorder about 2.6% of the population, bipolar disorder is actually more devastating in many different ways. In terms of the workplace setting, about 40 days per year are lost in the work setting because of depression, compared to about 65 days with bipolar disorder. All the more reason that we really need to be careful about it, helping people get the help that they need for this illness. In the most extreme cases with bipolar disorder, suicide is a potential outcome. The statistics vary on this, but you'll hear 10 to 15% of people will complete suicide with untreated bipolar disorder. In addition to this potential devastating consequence, there's many other things that can happen. Lives are really torn apart because of this illness. Marriages are broken, families are torn apart, jobs are lost, and it's a trickle-down effect if left untreated. It's hard to distinguish between major depressive disorder and bipolar disorder, and sometimes we really don't know the person has bipolar disorder until we see a manic episode. So the depressive features can look the same: changes in appetite, changes in sleep, changes in energy level, feelings of depression, loss of interest in usual activities, feelings of helplessness, hopelessness, worthlessness, and in some cases thoughts of death and suicide. Very similar for depression and bipolar depression. Some people have thought that maybe you have an atypical presentation with bipolar disorder, meaning maybe you eat too much and sleep too much. That's not necessarily the case. You can present anyway with this disorder. But how do we know if the person has bipolar disorder versus major depression? Well, again, sometimes we don't know until it's a full manic episode, but some things that we can consider are the current symptoms. Depression with a history of manic episodes. When we look back and we ask some further questions, did the person have mania at some point during the course of their illness? Early onset. Although this illness can present in a variety of different times in a person's life, typically before the age of 25 is more indicative of bipolar disorder. The course of symptoms with bipolar disorder, you often will see more abrupt terminations and onset of the depressive symptoms. Not to say that you can't have that with major depressive disorder, but typically with major depressive disorder, there's more an insidious onset. You slink into a deepening depression, whereas with bipolar disorder, you'll often hear people talk about a light switch. They were fine, and then they weren't. So it's very dramatic. Family history, incredibly important. There's high amount of genetics associated with this illness. So if the person is presenting depressed, but they say, my grandfather had bipolar disorder, we need to be thinking in terms of bipolar disorder. And also, response to antidepressant. We call them antidepressant misadventures. The person has been treated for depression, and they've been tried on a variety of antidepressant, and nothing seems to work. That might be a flag that this person has bipolar disorder. It could also be something called treatment-resistant depression. Or they were started on an antidepressant, and about 3 days later, they had a miraculous recovery. That is very unusual. That's a red flag. That's not how antidepressants work. So that's also sometimes gives us an idea that maybe this is something different than depression, and maybe we should consider bipolar depression. It's very important that we consider mood disorder questionnaires. There's a variety of those available to people on the internet. A lot of family practice offices use those as well. And we encourage that in our setting too. Sometimes people will, when they are given a chance to self-select some history about mania, they might come forward and understand better their illness. So bipolar depression, a serious illness, needs treatment, but it is something that does respond very favorably to treatment. Thank you.